Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. You may have noticed we skipped last week, so today's video will cover the past 2 weeks. And the trend is now clearly downward. Cases are still quite high, but we have clearly passed the peak of this surge. And if my buddy was here, well, he might not be standing on his head anymore. So please share this with someone you care about. For the country, note how much more orange there is now, just 2 weeks later. And especially note Missouri, down through Arkansas, Louisiana, and across the Gulf Coast to Florida. Delta really hit those places early, and now they're well down from those peaks. Southern California as well. Alaska still the only state above 100 per 100,000 population, a new case rate. And 16 states now in orange, none, however, in yellow or green. For our neighbors, South Carolina and Tennessee down some more, and now each with some counties in orange. In Georgia, note how much is now in orange, even some in yellow. The state as a whole soon to be in orange. In Florida, now the 5th lowest rate in the country after being so high just a few weeks ago. For North Carolina, 14 counties now in the orange, none in western North Carolina, however. You'll note here cases and hospitalizations well down. Deaths not yet. In western North Carolina, Swain, Clay, and Buncombe flat or up a little. Everyone else down. And note Cherokee County, so high a few weeks ago, now down substantially. As far as testing, North Carolina continues to go down as a whole, but notice in western North Carolina we still have some very high rates, even despite lower cases. And note Graham, finally a county in our region back under the 5% threshold. For the pandemic for Haywood County, the total is 7,081. That's a weekly increase of 245 2 weeks ago, but only 159 over the past week. And that's a weekly increase we've not seen since the week ending August 8th, almost 2 months ago, well, more than 2 months ago now, when things were really ramping up. But also note, we continue to track the curve of exponential spread. Deaths now at 136 for Haywood County. We have added 8 more in the past 2 weeks. The country has added an additional 100,000 citizens dying from COVID in this surge. And I will remind you, that's twice as many deaths in 2 months as we see in the worst flu season that lasts 6 months or more. And in Haywood County, we've already seen more deaths this October than we did all of last October. Haywood Regional Medical Center with fewer COVID-related admissions, but still with some of these in the ICU and on ventilators. The most impacted of our fellow residents continue to be those not vaccinated. Well, good news at last. We in western North Carolina are starting to see the downturn others in the country are seeing. And it appears the peak was around the middle of September, as many had suggested it would be, and that is in keeping with prior surges that lasted between 2.5 and 3 months. But although we are past the peak, we remain at significantly high levels, both in the region and here in our county. Some in western North Carolina are not down hardly at all, others down substantially. In Haywood County, we saw a steady 20 or so new cases a day over the past week, and with test positivity rates that have hardly gone down, however. And if this is so, we are still at a level way too high going into the fall and winter times, when it can be expected there will be another surge. And if you recall, last winter's surge started just before Thanksgiving, an already high level going into the holiday season, and we know how that turned out. Getting back down to more manageable level of new cases like we had early this past summer gives us our best chance to weather the next surge. And is there any evidence to suggest there will not be another spike? I think not. And the more cases, the greater the likelihood we get other variants. And might one of them be worse than Delta? Only time will tell. So right now the goal has to be getting the rate of new cases down to where they were this past summer. That would get us into the green, with favorable impacts on schools, workplaces, gatherings. Now, isn't that something worth working towards? So be well and be careful, especially right now.